Trends in the local coronavirus deaths by age have shown a high mortality rate for the elderly, particularly those persons aged 60 and over. On Wednesday, the Ministry of Health reported that a 65-year-old woman from Region 4 and a 64-year-old man from Region 1 are Guyana's latest COVID-19 fatalities, which have pushed the death toll to 123. As such, the Minister of Health, Dr. Frank Anthony, has indicated that the elderly will be given the COVID-19 vaccine during Phase 2 of the distribution. The minister in a recent interview disclosed that once a COVID-19 vaccine is approved for manufacturing, it will be procured, distributed in Guyana in phases. The first phase, which will account for 3% of the country's population, will be administered to frontline healthcare workers. For the second phase, 17% will be allocated to the population. Dr. Anthony pointed out that elderly persons with underlying conditions will be included in Phase 2 rollout.
Our intention then is to look at the people who are at risk for the disease, and those persons would include persons who are older, so maybe 60 or 65 years and higher. The other group of persons also would be people with chronic non-communicable diseases, so diseases such as diabetes, hypertension, cardiovascular diseases, kidney diseases, respiratory diseases, and so forth.
Additionally, he detailed that persons living with HIV and cancer-related infectious diseases will also be catered for during the second phase of vaccine dissemination.
Cancer patients, we have seen, they are not faring well globally in the epidemic with COVID, and therefore we will want to also put these categories of patients to be among the first to receive the COVID-19 vaccines.
While the quest for a viable COVID-19 vaccine continues, Guyana remains a member of the COVAX facility mechanism, which allows for equitable access to COVID-19 vaccines once they are licensed and approved for third world countries. Dr. Anthony highlighted that under the COVAX facility initiative by the World Health Organization, the Global Alliance for Vaccines and Immunization Gavi, and other partners, there are currently 9 vaccine candidates that are awaiting results for the final trial before the vaccines can be approved and manufactured.
None of the vaccines have been cleared yet for manufacturing. Maybe by the end of the year we'll start having some of them. And therefore we'll have to wait and see.
In a past interview, the minister had also informed that the first set of COVID-19 vaccines to Guyana will be free of cost to the government. He stated that Gavi will be covering the cost of the vaccines for Guyana as well as several other Caribbean territories. Temika Rodney reporting for the HGP Nightly News.